Gitumi kinene gia gwakwo gwa barabara ino kiari kunyihanyihia muhatikano wa ngari uria ukoragwo tauni-ini ino ya Thika.
Mururi wa Kameme TV ndakugeithia ndakunyita ugeni miarahuko ya muthenya wa umuthi ni mwihoko wakwa ati ni watindia wega na ithuĩ nĩ tuoka nigetha tukumenyithie maria marathie na mbere na kuhanika thiini wa mufutaratara wa mohoro gitao miarahuko ya muthenya uyu wa gatatu wa kiumia giki na ngakihoka ati no uragithie na mbere na gwaka bururi wa Kenya kuria tugugwikorwo tugithie na mbere tukiaragia maundu magitiganite na tugikumenyithagia uria kuhana na murori thaici ndiramenyithia ati kuri na ndereti irathie na mbere kana kuri na miario irathie na mbere egie ministry ya ugima wa mwiri guku bururi-ini ndirenda tuthie mwe kwa mwe nigetha tumenye ni mariku marakunuka thaici uguo nigetha tukimenya ministry ya ugima wa mwiri ni mariku mari namo magutumenyithia miaraho eno
of the work that they have continued to do. But before I ask Eva Jenga to also say something and perhaps respond to one or two questions that you might have, because I will not be having any other press conference today. This is it for the day. So if you have a question, we will allow you to ask the question. But before I do that, I also wanted to say one or two things regarding the position in the country today regarding COVID-19. The first one I would like to talk about is in discussions again with the medical personnel and persons who are informed, we have realized that it is possible that the weather that we are experiencing at the moment is also part of the reason why we may be seeing our figures climbing up. Not so much because of the particular weather of the day, but because this is the second peak season of the flu. As you know, we have two seasons, one in March and May, and then we have got the second peak, which is July, September, and October. And of course, when you get flu, then that means that you have an underlying issue regarding your ability and your immunity to protect yourself from the disease. And therefore, it's just to urge people, in this cold season, it is very important that we do a number of things. A is that we must avoid congregating together. That is the gatherings we have been talking about, and that informs you also. Part of the decision that we took to stop the sale of alcoholic beverages in restaurants and other places. It is part of that reason. It is to reduce the people congregating together. And you should avoid it. As a Kenyan, you should avoid it. And the second thing, of course, is to adhere to the infectious control measures that we have given to the country, and one not repeat the same thing over and over again. We have continued to try and upscale our testing. One of the reasons why we had slowed down a little bit is because the reagents that we got, the ones we have been getting from China, some of them by donation, some of them we are buying, what has been available has essentially been manual reagents. And when we have got the manual reagents, we cannot test as fast as we can with the automatic reagents. So that is why you see delays. So when and I want to apologize to Kenyans, when you hear that your sample was taken, it has taken you 2 days, it is not the intention. The intention is to give them with as few hours as possible. But when we have got manual reagents, then we have got a challenge as to how many we can actually be able to test per day. But hopefully, this situation is improved. It will improve. It has already started improving, and that is why for the day, we tested, in the last 24 hours, we tested some 5,259 persons, therefore bringing a cumulative figure of 289,759. Now out of those 5,259, some 544 persons turned positive, and out of them 340 are male and 204 are female. So we need to again, this gender issue, if we were getting just a number of male that we get for females, the figure would be substantially low. But I also want to point out to our female folk and our sisters and mothers, your figures are also now beginning to go up. So I hope it doesn't mean that you are also beginning to misbehave. And you know, as these figures begin to come up, we hear all sorts of rumors about China, about the effects of becoming positive. We hear very strange rumors, which I'm not going to participate in perpetuating, because I don't want to be a rumor monger. But the men should be careful. Men should be careful with this positivity that we are continuing to get, particularly young men. You should be very, very careful with the infections and possible side effects that in future, we don't know, but in future, we don't know what side effects some of these diseases will have. Let's be careful. We also lost 12 people in the last 24 hours in various hospitals around the country, which now brings the total to some 311 persons who have also passed on, and our sincere condolences to the families of those who have lost their loved ones. We have discharged some 113 persons, bringing our cumulative discharge a total of 8,021. And this is the work of our case management people, the doctors, the nurses, who are managing our people in such a manner that we can continue to increase substantially the number of persons we are discharging from our hospitals. That means that we are still retaining a fatality rate of about 1.6% as opposed to the current global one of about 4%. So kwa hivyo hakuna kuongeza mambo mengi. Kawaida ni kusema ya kwamba watu wale ambao wanazidi kuhitaji ile vitu ambao tumekataza, ni lazima mjaribu sana. I know sometimes it's a challenge. Wengine walikuwa wamezoea sana hii mambo ya pombe, lakini sasa wewe useme asante kwa Mungu kwa sababu amelete hii mambo ambayo itakuzuia wewe kwenda huko kwa bar kunywa pombe, na ile pesa ulikuwa natumia na hiyo pombe sasa unaweza kutumia kununulia watoto kitu kama guo, unaweza kupatia mama kidogo na yeye apate ka viatu nice. Kwa hivyo hiyo pesa ulikuwa natumia na hiyo mambo, wewe tumia na kitu mzuri. Wewe sasa angalia nyumba yako, uangalie uone ni kitu gani unaweza fanya. Wengine mama alikuwa anafanya kelele ya kitu fulani anataka, wewe mpatie, mnunulie hiyo kitu. Hata mimi nitafanya vile vile. Hata mimi nilikuwa nafurahia Kagwe special kwa hivyo hiyo pesa nilikuwa na hiyo maneno, hata mimi nitasaidia pahali, ama nimpe mtu mwingine nyumbani, ama nisaidie kununulia mtu mask ambaye alikuwa hana mask. Tukifanya mambo kama hayo tutakuwa na saidiana sana, na itakuwa jambo la maana na jambo mzuri. Kwa hivyo Wakenya, tafadhalini, hii mambo tuishukue kama ilivyo, tujue ya kwamba this is a dangerous time, but we must also live. We must also stay alive. And to stay alive, we need to be positive. We need to assist each other. The way the doctors act for us, the way they give themselves to us, the way they participate in saving our lives is a way that we should try and emulate in saving each other. We save each other. You save me, I save you. You protect me, I protect you. To say something regarding the institution, and particularly to tell you in the media perhaps a little bit about the challenges they have had and the successes, because Kenyans are too happy. I want to warn you, Dr. Jenga, to just say positive things, because the minute you start criticizing yourself, you are going to give fodder to people who are very, very ready to say that you have done absolutely nothing over the last 6 months. But I'm not talking about these members of the press. Members of the press in Kenya have been extremely positive and extremely helpful. And we want to thank you as well for the work that you have continued to do. The only thing I would urge is that when it comes to the interviews, bring in people who know what they are talking about. Thank you. Dr. Jenga, please.
I'll keep my mask on also. Thank you, CS. We do appreciate the good words you have said about the council, and I know the council members really feel appreciated. And even as much as we know we are in this battle, all of us, because we are patriotic and we are working for the Kenyans, which is always nice when our bosses also know that and appreciate us. So thank you again. So I think it will be nice to highlight what does the council, as a regulator, what it is. And I'll say this in a very summarized way, because there's a lot of things. We are here to regulate health, the quality of health that is in the institutions, the facilities. We license the facilities, and before we license them, we inspect them. We also have the mandate to actually decide on the quality of the doctors that we train. So through the people who qualify to come and do medicine, this council has a mandate to give the criteria at the minimum grades that somebody going to do medicine. And even as you do medicine, we come and monitor the universities, the medical schools that you are training. There are some guidelines as to what a medical school must achieve to be able to be recognized. We are also governed by the East African Joint Inspection Regulators, which was approved by all the ministers of health in the region, whereby there is an agreed minimum qualifications and standards for medical schools and even students, so that we have what it's called, we recognize each other across the region, so that we have reciprocal registration. So someone training here and qualifying here does not have to go and sit exams in Uganda or Tanzania. They can go across the boundaries and actually get a job. The same thing, people coming from our partners can come and practice here. And they present their papers to the various regulators. They are examined through the committees. And if you satisfy the committee that you have the criteria to qualify, you are allowed to practice. This way, we are able to regulate and to avoid and to catch up with quacks, because I won't call them doctors, they are quacks who try to pose as doctors. So that one, we are now very much alert, and we've been able to bring people and get them whenever anybody tries to come and register. Because all we need to do is pick a phone, get on the computer, and get to our partners in Tanzania and find out, are you sure this person qualified there? And what is important also, through the East African region, we are putting all our members on our website. Everybody, we have indexed our medical students, so everybody is online. So it's easy. If a member of the Fourth Estate calls me and asks me, is this person licensed? All I need is the name and the year they qualified. And my IT people will just get online and they'll tell me, we don't have such a person. And I'll call you back and tell you that's a quack, it's not a doctor. So it is easy now. And we are able to do that because we've developed our IT system. It's very strong. It's not 100%, but we are getting there. 80% developed. We still need to get it to a point whereby we can make sure anybody, you can click on our website and be able to check. You can go to a facility and check whether it is actually licensed by the council. By looking at you, that's every facility, even my clinic, I display my license from the council. So if you go to a facility and they don't have the license from the council, then you should question yourself and find out, am I going to a safe place? So these are the things as a council to protect our people that we are doing. We are going further to improve the IT system so that we in the country will be able to improve telemedicine. And this will be able to be licensed. It will get the registration and gazettement from the Ministry of Health, so that since we don't have enough specialists for the whole country, we can have a specialist, maybe a critical care specialist or a radiologist, looking at an X-ray here that will inform somebody, a patient diagnosis in Kajiado or in Madeira. This is going to happen in the very, very near future. It is already happening in some counties, but we want to make it national. So in essence, that is exactly what this council is been doing. But Quickly, can I tell you what we've been doing in the last few months in COVID? This council has been involved from the word go. When the Ministry of Health and the government said all the flights must be quarantined, all the travelers coming in, it is this council that put everything together. We worked very hard, and that is how the numbers of the numbers you are seeing today are not in the thousands. Because initially we had almost every COVID that came in was a traveler. But of course, because of sometimes some of the things, this virus, the way the virus behaves, we could not avoid the local transmission. And this is where now we are at. How can we slow down the local transmission? You have heard a lot that we are going to get a peak maybe in August, September. And that is where everybody in globally, they have to get to a peak. But we are not just sitting back here waiting. So what we are doing at the moment, we are going to mobilize to have more quarantine centers with the support of the Ministry of Health, with what the President announced the other day. Our CS now has the power to get any institution, any government facility, and upgrade it to a quarantine and even to an isolation center. Why are we saying this? At the same time, we are saying you can quarantine at home. There are people in the informal sector, much as they may want, if they know they have someone in the house who is positive, there's no way they will have proper quarantine or isolation. And these are the people we now, as in the government sector, we must save them and get them into safer places. And it's no longer mandatory quarantine, it is protective and safe quarantine, whereby we have now psychosocial people, we have psychologists, we have people to talk to them so that you don't feel that you are being sent away because you have done something wrong. What we must do and must do again is dispel the fear and the stigma. And this is why what CS has said, you want me to give you doctors who know a lot about case management, tell you about this, about behavior change, about how to dispel fear, how this virus you can actually go through and survive. We have the doctors. But you also need to have somebody who can tell you the danger of this virus if it's not well managed. Why are we having these deaths? And then to even mitigate that death, the ministry is working so hard. And I'm not praising you, CS, because I've been in some of the committees looking for ways of providing oxygen in the whole country. Because oxygen is the best, the number one line of treating these patients. So we need to make sure every facility that's been designed as an isolation center must have oxygen. So this is already going on, and I know in the next 1 or 2 weeks, most of the facilities will have oxygen. So I know good work is going on, and I think the idea is all of us support each other. You as media, you are doing an excellent job, and I think you will continue to do that. Us now, as professionals, as individuals, as the population, the task is ours, the responsibility is ours. Don't take out your mask. Do not fail to wash your hands. We know that this virus only lasts in the air for a short while. And also if somebody is coughing straight on your face, if you cover yourself, even if somebody coughs when they are there, you will not get the virus. And if you go and touch spaces where somebody has got the virus and you wash your hands, you will not get the virus. So simple things. So don't wait to go and get very complicated drugs and go get into ICU. Keep yourself safe, and we can do this. So CS, I think that is more than enough for now, and I think I'll allow you. And thank you so much for allowing me to do that.
Thank you. Thank you very much, Daktari. And I want just to support what you have said, Daktari. You know, as we speak today, some 634 health workers, health professionals have actually turned positive across the country. It's about 3%. It's about 3% of the cases reported, which is very low because globally, healthcare workers represent about 10% of the reported cases. And in urging that we continue to protect our healthcare workers, you will recall that yesterday I talked about PPEs. I can confirm here and now that we have sufficient PPEs in this country. If there is a problem, it's probably a problem of management, problem of distribution, but most certainly not a problem of availability. And as you know, we have also allowed that counties can be able to buy and procure their own PPEs with money that we have given them without any reference to the ministry or indeed to KEMSA. We are also asking that professionals, the health professionals themselves, must adhere to what we are saying. And it's great that I'm talking from this institution and from this platform, because we also know that there are some health professionals who are misbehaving. And I can quote 2 cases without naming names, because otherwise Dr. Jenga and Daniel Yumbia might take action. We had 1 case of a doctor at Kenyatta National Hospital, a doctor, qualified doctor, who had traveled and instead of quarantining themselves, wanted to proceed on to go to the theater and conduct surgery. Fortunately, they didn't, because some nurse reported him. Thank you to the nurse. We also had a case just this week of another doctor who was actually turned positive and wanted to continue behaving normally. Go to a theater and start conducting surgery, and you are positive. You know, honestly, this borders on criminal behavior. So we want also to tell the healthcare workers, tafadhalini, whether you are doctors or dentists or pharmacists or whatever, please, tafadhalini, you must follow. You are the first line of defense. And if there is discipline required during times of war, the highest level of discipline is expected from frontline soldiers. And you are the frontline soldiers. If you slack, we can lose this war. So please, I urge you, tafadhalini, tafadhalini. What we are saying is what we must do. If we preach water, let's take water. Let's not preach water and then partake of wine. Asanteni. Any urgent question? Enda kazi.
Ucio ni CS kana Minister wa Ugima wa Muingi guku bururi-ini CS Mutahi wa Kagwe agikiheana ndumiriri ya muthenya wa muthi na wakiigua makiria ma andu 500 nio mekiritwo mukonde gukorwo marwarite COVID-19 gwa kahinda ka mathaa 24 mahitukite. Rondu umwe ni twagikorwo tugite andu maiganona kurumirira COVID-19 guku CS agikithie na mbere na guthingatithia a Kenya makorwo magikirira muno makiria uhoro wigie ugima wa mwiri gwithamba moko na maundu matiganite. Ndathikiriria ndagitari ucio kwaragia ndakiigua na maundu maria mahuthu muno nimo mangituma tutikagie COVID-19 gwikira karembeko gwithamba moko na ningi guikara haraihu na mundu uria ungi. Tukihore murika ndeto ege tuthie kuria kaunti-ini ya Mombatha na ni ati aikari a wadi ya Jomvu kuria kaunti-ini ya Mombatha nimeranire na kwirwo makenia ati nimegukorwo makiungania thairi cia kuhagura MCA wao makiuga ati ndakoretwo agitabania mitaratara ya uthii wa na mbere kuringana na matanya mao kuma hingo iria acagurirwo. Mwandiki witu Ndegwa wa Gathungu akoragwo kuria kaunti-ini ya Mombatha hingo ciothe na riu ndirenda tunyitanira nake atumenyithie ni mariku marakunuka mwena ucio. Aikari aya a Jomvu Ndegwa
muno gathi na mbere na kunyamukira na njira njega muno makiria kuma mwene wa gicua-ini na makiria thiini wa kaunti ya Mombatha na kahinda-ini gaka ndi gicigo-ini kia ubunge kia Jomvu thiini wa wodi ya Jomvu kuria thiete na mbere na kurumanirira na mawoni ma muingi kuria maugite ati matikoretwo makenetio ni MCA uria umarugamirire thiini wa bunge ya kaunti ya Mombatha na hatari gute mathani gwenda twaranirie na eri kana atatu niguo tuthikiririe mateta mao. Na ningeomba uanze na majina na utueleze ni nini imefanya muungane siku ya leo ukiangalia pale.
Kwa majina naitwa Karisa Katana na kitu kimetufanya paka tuonane hapa kwa siku ya leo ni kwa sababu ya MCA wetu ambaye kwamba tuko naye hapa lakini hatusaidii na chochote katika area letu la Jomvu hili. Sasa sisi tunaona mtu kama huyu hawezi kutufaa kwa sababu yeye anafuata mambo yake, yale mahitaji yetu hayashughulikii. Sasa hatufai sisi mtu kama huyu. Afadhali aenda kakae pembeni, at least tuangalie mtu mwingine. Hiyo tu, kwa sababu kijana tunaye ambaye tunaweza kumweka pale na ataongoza vizuri bila shida. Manake mtu wakati unapotafuta kazi, unapopewa kazi ni ushughulikie wale ambao wamekupa ile kazi. Lakini sio wewe umeomba kazi umepawa alafu uishughulikii. Tunashangaa sana kwamba kijana mdogo amejitokeza kuomba kazi. Hatujampa kazi lakini anatufanyia kazi. Kwa hivyo kijana kama yule saa 12:22 atakuwa yuko ndani. bila shida yoyote, kwa sababu tunamtaka huyo mtu sisi. Shaona hiyo tu.
Naam, asante sana. Wacha tusikize maoni ya mama hapa. Karibia hapa mama, tupate kupata maoni yako pia, na uanze na majina na ueleze ukiangalia kio.
Kwa majina naitwa Swabra Lamin, ni mkazi wa Jomvu Ward. Si tuasikitishwa na MCA wetu. Manake yeye ndo wa kwanza katika kile kikundi wanachotaka kujua pesa yenye imetoka itatumika vipi na imeenda vipi. Lakini tuasikitika yeye mwenyewe amefunga ofisi. Malalamishi yetu si tutayapeleka wapi? Ametufungia ofisi. Sasa yeye kama ofisi ameifunga, hiyo pesa ataka kujua imeenda vipi ili aifanyie nini? Kwa sababu yeye mwenyewe afunga ofisi. La pili, yuatuharibia vijana wetu. Nikisema yuatuharibia vijana wetu, youth wanataka kuwa empowered. Yeye ndo wa kwanza anawanunulia mgoka. Wakika vibarazani. Sasa mtu akishampa mgoka atafanya kazi ama ataka kibarazani? Sisi tunachotaka ni mabadiliko. Tunataka kumtoa MCA wetu. Hatuna kazi na yeye. Manake tulomtuma kwenda kulifanya huko kwenye bunge la county hatufanyii.
Asante sana kwa kuongea nasi hapa Kameme TV. Noaigwa acone makayana maguriko maige maikari a itura riri ria Jomvu thiini wa ward ya Jomvu ku kuria mathiete na mbere na kumenereria urugamiriri wa MCA wa Abdara Shebe makiuga ati kwa ihinda riu akoretwo gitiini kiu ndakoretwo akimateithia na Abdara Shebe arari umwe wa ama MCA aria marakoretwo muharini wa mbere gutigirira ati governor Joho ni arutwo gitiini giake kia governor na uguo riu aha gatumura mbica ingi ira tugukorwo tugithie na mbere na kurumanirira nayo thiini wa mohoro maitu marathie na mbere kana maria megukorwo magikinyira mwiroreri wa Kameme TV kuma gicigo-ini kia ubunge kia Jomvu ward-ini ya Jomvu ku county ya Mombasa. Ritwa riakwa ni Ndegwa wa Gathungu Njokie Mwaro wiko studio.
Ndo wa ripoti yo na gutumenyithia uria maundu makihana kuria mwena wa Mombasa. Tukimurika ndeto ege mururu wa Kameme TV ni ati muingi wa kuria Mlolongo athiriva orodo mwena kuria kaunti-ini ya Machakos riu ni matetetie na kumenereria ahami a mugunda aria riu mahamite mugunda wa muingi mwena uyu na kuria makorirwo makimamomorera kuria maikaraga orodo mwena gwikira biashara ciao. Kwa ihinda riri maabitha a borithi nio matumitwo kuu kurangira mugunda uyu uria ni wa muingi uyu kiaga gukenio ni ndeto eno toria wa Boy wa Maina aratutariria.
Muingi wa Mlolongo ugomanite haha gucenjania meciria ma ikinya riria magutacukia thutha wa ahamia migunda kwigwatira mugunda uyu wa eka 400. Aikari ni mamenereirie gikundi kimwe kia ahamia migunda guku makiuga nyumba ciao ni ikoretwo ikimomoro na itanya riao ni gutigirira ati muingi ni wa thama cikaro-ini ciao.
Wengine wako hapa na familia wameteseka, sasa wengine wanaachwa nje na watoto. Hata tunashangaa sasa tetesi wetu natoka wapi?
Kuringana na muingi maabitha a borithi ni manyitite itemi nene hari ndugamano ya mugunda uyu kuona ati nio matumitwo ni ahamia acio kurangira.
Ile shida tuko nayo hapa ni hao maaskari wanakuja wanalipwa na woria na badala ya kusimamia woria hata wananyakua vitu. Wakipata mtu wanatembea kundani wananyakua vitu. Ona gutwika aigi guku ni kwa moita mucie maugite ni gukoretwo na jama ya kumahamurithia guku ahami makihuthira marwa ma ngungo niguo kuhinga muingi maitho na kumatunyukithia mugunda uyu.
Kama wanadai tuwalipe kwanza ndio tuendelee kufanya maendeleo hapa. Hata juzi wamefukuza watu wengine wakichenga hapa, wakipata kama huyu walimfukuza akichenga hapa isiketo niko hapa. Hapa. Pata wengine wanawanyang'anya vyombo wanaenda naso kama hawajawapea pesa.
Hao matajiri ambao wanajiita matajiri na wako na ile title ambayo si shamba yao na wanaleta maaskari hapo wanakuja kufinya watu wengine.
Igeria ritoria kwaranire na munene wa borithi wa athiriva iguru rigie ndeto eno ritinagia na umithio. Handu-ini ha Kameme TV ritora kwa ni wa Boy wa Maina.
Thank boy nä ndå wa riboti ä yo na nä we gå korwo ä gä tå ithäraniria mohoro gä taå mä arahå ya må thenya wa må thä no ndigå gå tiga å guo ndärenda ngå tige na Kagwe special agä thiä na mbere na gå cokia ciå ria cia andä ki a mohoro thä inä wa ndå mä rä ri yake ya må thenya wa å må thä niä njä tagwo gä cimå tuma na mwä haki wa kä mathi å rä a nä mwathä rä ri na njä ra ya ciä ko tå gå cemania mathaa macio mangä ma hwainä
days or so from the time we had our first or 10 infections. If you go and Google at this time and ask yourself what was happening in Italy, what was happening in Spain, their curves went sharply upwards and their entire health system was totally overrun. The reason why we have not been overrun yet, it is not that we are not going to get the cases. The cases will come because they must go up. But they are coming at a pace that our health facilities are able to cope. And that's why, for example, we are next week, we are launching extra facilities for treatment at Kenyatta University Referral and Training Hospital. We have put the 500 beds I spoke about, 60 of which are ICU. ICU is an ICU facility. But remember also that we have had tremendous growth. I tell you, if Kenyans could sing about themselves, for once, they would sing good songs and positive songs. I saw in the media, for example, a video of a Ghanaian facility that Kenyans are passing towards each other perpetually as a great achievement of a 100-bed facility that they put up very quickly. And it's fine. And I congratulate the Ghanaians for putting up that facility. But when we started this journey, we had 8 beds. Next week, Kenyatta University Hospital on its own, in the last 2 weeks, I put up a 500-bed facility, including 60. This is not something that you hear, about in many parts of this continent. That facility will now have almost 1,000 beds. And you're talking about us praising and getting very, very impressed by some other country because they have done a 50-bed facility. I think Kenyans beat themselves up way too much. Appreciate yourselves. You have done a fantastic job. Any county in this country has got a higher capacity that Kenya had at the start of this infectious disease. Any county has got a higher facility, has got a higher capability than the entire country had. And I think that's a story that if you don't want to tell yourselves, at least you should write for our grandchildren. Now, as the issue of quarantine and the facilities of quarantine, I think it is good, it is better for us to be prepared than to be sorry. And that's why we have said that our education institutions, we are converting a lot of our education institutions into either A, quarantine facility, or B, isolation facility. And this is specifically to assist in densely populated areas where the economic status is such that people are unable to quarantine themselves or to be able to isolate themselves. And one other thing about this whole thing about quarantine and isolation, I think in terms of behavioral change, I can report and thank Kenyans because we have seen a fantastic change in the ability to quarantine themselves. People genuinely go and quarantine themselves and behave in such manner because they are now aware. Their awareness level is high. They know they can affect their own families. And we have a lot of Kenyans. We have a lot of Kenyans today who are at home, quarantine or isolating themselves. And I want to thank them. And that behavioral change is saving us a lot of money and is saving a lot of grief because, and Dr. Amos said this yesterday, people who are doing so at home are getting better faster than people who are doing so in hospitals. I think I have basically addressed the issue of the human resource. Yes, again, we continue to upscale and train. And we are training at 2 levels. We are training at the community health worker level because those people who are isolated at home, quarantined at home, can be assisted by our community health workers. And there are many. And every county currently is carrying out the training. The ministry itself has got continuous training for healthcare workers. There we have even got a lot of healthcare volunteers who are also working at the county level and being trained. I think you saw the visit that I did in Nakuru County in one of those facilities that is a training facility for volunteers in the county. So we will continue to upskill the healthcare workers, to train, to protect, to increase the numbers as we are able and as the need arises. Thank you very much. I think, Dr. Jenga, you had one question which you can answer.
Thank you, CS. You've covered most of the questions. My question about, you're from NTV? Yeah, you asked about facilities that are providing family planning to other age. I only tell you in summary that the council is going to inspect, and we're going to do the needful, but we will not tell you when, because we do this impromptu. Otherwise, if we announce when we are going, we find the place either closed or they have removed everything that will show that they had been giving any form of family planning. So we have our own way, we are on it, and you will get to know once it's done. Thank you.
Asanteni sana. Thank you very much.
When the world